The Inner Physician, a primer on yogic therapy and the intelligence of healing. 1. The core paradigm, your body as a self-healing organism. As a young boy, I moved through the world with the effortless vitality of youth, barely aware that disease even existed. That changed during my university years when I contracted jaundice from a friend. What followed was a cycle of frequent illness and debilitating stomach ulcers. It was a dark period of seeking external fixes until I met two mentors who would rewrite my understanding of life, Healer Bhaskar and Aku Healer Umar Farooq. They taught me a truth that is as simple as it is profound. Your body is not a fragile vessel waiting to break, but a masterpiece of biological intelligence. It possesses an inner physician capable of rectifying almost any imbalance. Healing is not an external intervention forced upon the body. It is a natural internal restoration that occurs the moment we stop resisting our own biology. Core principles: inherent intelligence. The body possesses an inherent intelligence, a sovereign power to heal and cure itself. Most discomforts and diseases are not signs of failure, but are the active, deliberate attempts of this internal intelligence to restore balance. This intelligence speaks a language we often misinterpret. To begin our journey into yogic therapy, we must first learn to listen to the body's sensations without the filter of fear. 2. Redefining pain, the surgeon and the thorn. We often view physical suffering as an intruder, yet yogic therapy suggests that the treatment itself is hidden within the form of the discomfort. Imagine you have a thorn buried deep in your foot. A surgeon must use a sharp scalpel to reach it and pull it out. That procedure is undeniably painful. But is the surgeon your enemy? No, they are a well-wisher. The pain of the surgery is actually the process of the cure. When your body creates a sensation of pain or swelling, it is acting as that surgeon. It is drawing blood flow and the brain's focused attention to an injury to initiate repairs. If we treat the sensation as an enemy, we are effectively fighting the doctor who is trying to save us. Traditional perspective, pain as enemy. Yogic therapy perspective, pain as treatment. Pain is a malfunction that must be silenced. Pain is the body's medicine. The sensation is the treatment. Discomfort is a poison to be escaped or suppressed. Discomfort is the inner physician performing necessary work. We should use drugs to numb the signal immediately. We should permit the sensation to exist so it can complete its task. The goal is to remove the symptom. The goal is to allow the body's intelligence to resolve the cause. Once we stop viewing pain as an adversary, we can begin to see the beautiful stabilizing mechanics at play behind our suffering. 3. The mechanics of discomfort. Ripples in a pond. Yogic therapy 2. To understand what we call yogic therapy 2, imagine a perfectly still pond. If you drop a heavy stone into that water, it creates a dent or a hole as it sinks. Instantly, the water reacts. Ripples and waves dance outward from the point of impact. Do these ripples make the hole deeper? Quite the opposite. The ripples are the water's way of stabilizing its surface and filling the void. In this analogy, the stone is the underlying problem, the injury or infection, and the ripples are the discomforts, the pain or swelling. The ripples do not increase the problem. They are the body's dynamic method of managing and solving it. The three-pointed approach to healing. 1. Understanding. Recognize that bodily discomfort is not the disease itself, but the body's active treatment plan. 2. Acceptance. Consciously label the discomfort as a helper that has arrived specifically to assist you. 3. Recognition. Treat the sensation as beneficial. By shifting your perspective, you change your biological receptivity to healing. When we understand the purpose of these ripples, we can move from a state of panicked resistance to one of peaceful observation. 4. The resident with the sword, a story of perspective. Perspective is the bridge between suffering and relief. Imagine you are being mugged in a dark alley. A man comes sprinting toward you, brandishing a massive gleaming sword. Your heart hammers with terror. But then you realize this man is a resident of the street who heard your cries. He isn't there to hurt you. He is there to chase away the robber. The sword, the pain is still sharp and terrifying, but your understanding of the intent of the person carrying it changes everything. If you view a sensation as poison, you trigger a stress response. If you recognize it as a resident coming to your aid, you relax and allow the healing to happen. I recall a motorcycle accident where I was tossed onto the road bleeding from my nose and ears. As my friends argued over which hospital to find, a profound giddiness swept over me. I felt I might pass out at any moment. Rather than fighting the sensation, I sat on a stone and observed the giddiness with a full heart, giving it complete freedom to move through me. Within seconds, the giddiness vanished. I remained conscious and normal simply because I stopped treating the sensation as a threat. Case study, the power of thought. A gentleman from Trichy once told me of a friend who was perfectly healthy until a checkup revealed he had diabetes. The moment he knew the diagnosis, the symptoms suddenly manifested. This reminds me of the legend of the agent of cholera who was ordered to take 10,000 lives but watched millions die. When questioned, the agent said, I only took 10,000. The rest died out of fear. Our thoughts can often be more damaging than the ailment itself. 5. Practical technique, merging with the pulse, yogic therapy 1. While the second method focuses on reframing our thoughts, yogic therapy 1 is the direct practice of merging with a sensation. I discovered the power of this during a yellow scorpion sting. The pain was excruciating, but instead of trying to escape it, I observed it softly and patiently. Within just 5 minutes, the pain that usually lasts hours was entirely gone. Steps to merging with sensation. Permit the sensation. At the intellectual level, decide not to be an enemy. Stop the internal no. Identify with the sensation. Treat the pain as an integral part of yourself. Imagine it as an ant crawling on your skin. You observe it, identifies with the feeling of its movement without trying to flick it away. Provide space. Do not stare at the pain with tension. Instead, consciously provide full independence and space for the pain to penetrate as deep as it needs to. Observe the pulse. You will notice the pain is not a solid block. It is a series of pulses occurring in quick succession. Identify the interval. As you stay merged, you will eventually notice a gap or a painless interval between pulses. Widen the gap. By maintaining peaceful concentration on the sensation, the interval naturally widens from 1 second to many until only the painless interval remains and the pain vanishes permanently. 6. The science of acceptance, water and thought. This isn't just positive thinking. It is biological cooperation. Research shows that our thoughts structuralize the world around us. When water is subjected to abusive words, its crystalline structure becomes distorted and ugly. When it is praised with a happy heart, it forms beautiful flower-like structures. Since the human body is approximately 90% water, our mental attitude toward our discomfort helpers creates our internal environment. This mirrors the principle of homeopathy, where similar problems are solved by similar medicines. By accepting the sensation, the similar problem, we allow the body to use it as the cure. Wholehearted recognition that the discomforts protect us gets reflected in the water molecules present in our body, and consequently our body cooperates with yoga therapy. 7. Guidelines and boundaries for the learner. Yogic therapy is a path of truth, but it must be traveled with wisdom. We have the first aid rule. This is primarily a first aid measure for acute discomfort. I once used it for a back catch that had plagued me for years, requiring frequent injections. After using this technique once, the catch vanished and has not recurred for 5 years. The toothache exception. Toothaches are unique. In my experience, therapy 1, merging, can actually increase tooth pain. However, therapy 2, recognizing it as a ripple, is transformative. During a trip to Hyderabad, I applied therapy 2 to a severe molar infection. Not only did the pain vanish, but the tooth strengthened and healed so well I could chew soft food again. That tooth remained healthy for 3 years following the incident. The conscious requirement. This method generally does not work for animals or very young children. The reason is simple. This is a conscious therapy. It requires an intellectual understanding and a deliberate choice to stop fighting. Children and animals naturally try to escape or fight discomfort, which blocks the process. Professional consultation. For serious, chronic, or life-threatening ailments, always seek a qualified medical practitioner. By adopting this simple open path, we stop being the obstacle to our own recovery. We begin to trust the profound silent intelligence that has been looking after us since the day we were born.